As a medical provider, once a patient has a diagnosis of high blood pressure, fortunately we have a slew of blood pressure medications in different categories, different classes that we can use to treat high blood pressure. And that gives us an advantage in regards to being able to take an individual patient and tailor their treatment based on any other comorbidities or any other medical problems that they may have in addition to hypertension, to try to maximize an opportunity to try to get their blood pressure under control. As a primary care doctor, the most common classes of medications that we use are, number one, diuretics, which tend to allow a patient to urinate excess amount of fluid in their body. So that's one commonly used. The second one, they're called ACE inhibitors, which are commonly used especially in patients with diabetes and hypertension. The third one is calcium channel blockers, which are medications that dilate the arteries in the body to try to decrease the pressure that has been generated in those hardened arteries. And then there's a whole other class of medications that doctors can use depending on the needs of the patient. Some providers, if a patient has underlying heart problems, they can use this other class of medication called a beta blocker, which tends to decrease the heart rate of the heart so it doesn't have to work as hard to get that blood out into the body. And then there's some other medications that are not as commonly used but can be used if you have a patient that needs 3 or 4 medications. Usually if it gets to that point, these patients have to be worked up for other secondary causes of hypertension that I had mentioned previously, which are usually metabolic disorders, kidney problems. They can have underlying arterial problems such as renal artery stenosis. So at that point, once you get to 3 or more medications, you have to start getting concerned about whether there's other secondary causes of hypertension going on. But in the primary care arena, usually with 2 or 3 medications, we can get a patient well controlled in addition to them changing their lifestyle, as I mentioned previously, with all the modifications that they have to do.
Medtwice.com